Technology. I think perhaps the most important, most momentous thing happening in healthcare is electronic health records, because electronic health records create evidence. They create data about individuals that can be looked at for providing better individual care. They also provide societal population data that can be looked at in terms of what treatments are working, what drugs are working, what isn't working, what's the cost of this treatment versus that treatment. Electronic health records are going to be the earthquake that changes healthcare. Caregivers in particular, but also payers, see those electronic health records as their proprietary advantage. Well, my personal feeling is that's bull, and that's going to change. And I think the same thing that happened to Microsoft Office is going to happen to electronic health records. The information is yours. It's your personal information. One of the really interesting things, I think, just as an analog for that, is when you give people a choice about that information and how they use that information, they are choosing to share it in ways that the patriarchal society that we live in has prevented up until now. A really good example, you may be aware of, Apple put this tool out a couple of years ago that lets you share bits of information about yourself for clinical trials, for disease states, right? Exactly. So the interesting thing about that is they signed up more people in the first 48 hours than any clinical trial has ever signed up. Wow. So when people are given the opportunity to share that information, they want to share that information. I mentioned before that I was going to talk about AI. This, to me, is one of the benefits of AI. It's creating meaning out of your electronic health record. So I've got all these interesting data points, these lab results, these things that doctors have said about me over the past couple of years, and I'm in visiting my doctor. What do? I mean, the standard way is let the doctor tell you what he or she thinks is best for you. But artificial intelligence, in my opinion, the way this is going to play out, if the personal health record plays out the way I think it will, is there's going to be AI on top of that, because the personal health record, as we all know, is always going to be complex for someone who's not a professional. But something that helps steer your discussion with your caregiver is where this is going to play out. That's where AI, I think, is going to be one of the big success stories. So I've got this personal health record on my iPhone. Doctor, these are the questions I have. It's steering the discussion. It's not causing you to self-medicate. It's not causing you to decide, oh my God, I must have disease X. But it's causing you to have a better, more informed conversation with your doctor. That is going to be a huge benefit of AI. And I think that's what's going to enable PHRs to take off, because it will create patient engagement, because you'll have an interesting question or conversation with your doctor because of that information.